Okay, so again, my name is Nicole Gianetti. I'm a rising second year medical student here at SUNY Upstate. And today I'll be discussing HIV and COVID-19, what's similar and what's not. The two images on the screen right now, on the left is actually a 3D model of the HIV virus, and on the right is a 3D model of the COVID-19 virus. So before I really get into detail of HIV and COVID-19, I thought it'd be a good idea to give a general definition of what a virus is and really lay the foundation for common knowledge of what viruses do, how we classify them, and how they cause problems for humans. So viruses are non-cellular particles made up of genetic material and proteins that can infect living cells. Going more into the specifics, a virus is an incredibly small infectious agent capable of infecting animals, plants, bacteria, and fungi. The typical virus is approximately 1/10 the size of a single bacteria and 1/100th to 1/1000th the size of a human cell. All viruses contain two general components, the viral genome and a surrounding protein shell called a capsid. And what a capsid essentially does is protect the genome and helps a virus latch onto cells. The viral genome, just like ours, is an instruction kit for the production of proteins the virus needs. The genome can be made up of either DNA, as is the case with virtually all other creatures such as ourselves, or its close chemical relative, RNA, which encodes genetic information just as DNA does, but is much more flexible and somewhat less stable. Viruses are also known as obligate intracellular parasites. And what this means is that they cannot reproduce outside of their host cell, meaning that they're entirely reliant on the host intracellular resources. And the primary role of the virus is to deliver its DNA or RNA genome into the host cell so that the genome can be expressed by the host cell. Predominantly, viruses have a reputation for being the cause of diseases and infections. So really, they have this really bad reputation amongst us. Widespread events such as disease and death have no doubt bolstered such a reputation. What can come to mind might be the 2014 outbreak of Ebola, the 2009 swine flu pandemic, the 2002 SARS, so severe acute respiratory syndrome, and the 2012 MERS, so Middle East respiratory syndrome, likely come to mind when we're talking about COVID-19. This graph is really just further emphasizing that viruses are extremely small. And again, the typical virus is approximately 1/10 the size of a single bacteria and 1/100th to 1/1000th the size of a human cell. And now I want to get into how we classify viruses. There's really three general ways that we do classify viruses. Viruses are classified on the basis of morphology, chemical composition, and mode of replication. And what I mean by morphology is really the size, shape, and structure of a virus. The viruses that infect humans are currently grouped into 21 families, reflecting really only a small part of the spectrum of a multitude of different viruses whose host ranges extend from different types of vertebrates to protozoa, and from plants and fungi to bacteria. On the basis of shared properties, viruses are grouped at different hierarchical levels, starting from order to family, to subfamily, to genus, to species. There's more than 30,000 different virus isolates known today and are grouped into more than 3,600 species and into 71 families. And now for the really important information is how do viruses enter the human body? And this is really relevant for us as a public health measure and to prevent ourselves from getting infected with viruses. First, I'm going to talk about how viruses enter the human body through inhaled droplets. So droplets are produced when the person who's already infected with the virus has a contagious cough or sneeze. Once in the air, the virus-filled droplet can enter another person through their nose or mouth. Droplets can also land on the surface of an object and be transferred to nose, mouth, eyes, or by the hand. Viruses that spread through droplets often infect the nose, throat, and lungs with symptoms that include nasal congestion, sore throat, cough, and difficulty breathing. Diseases caused by viruses spread through droplets include COVID-19, influenza, so the flu, and the common cold. And this is really important to understand about these inhaled droplets. When you're out in public, you really want to make sure that you're not touching random objects, because you never know if someone sneezed on the door handle or coughed on the handrail or coughed into their hand and then started touching everything around you. So if you are in public and you're touching different objects that can be touched by thousands of different people throughout the day, it's important to really not touch your face, so that will prevent you from itching your eyes or touching your mouth or your nose, because those are great entryways for the virus. And if you are touching things, you really want to make sure that you're washing your hands as much as possible, maybe even carry around some Purell to disinfect as soon as possible. The second major way a virus can enter the human body is through contaminated food or water. The virus enters the body through the stomach or bowels when the contaminated food or water is swallowed. Viruses spread through food or water often affect the GI tract and can cause symptoms such as nausea, vomiting, and diarrhea. Diseases caused by viruses and contaminated food or water include viral gastroenteritis and hepatitis. Now, the third major way of how viruses enter the human body is through direct contact. Some viruses do need to directly spread from one person to another, and these are typically spread by blood, sexual contact, or from mother to child at the time of birth. Diseases caused by viruses spread by direct transfer include hepatitis, HIV, and herpes. And now the last way that I'll be talking about of how viruses enter the human body is from bites from insects and animals. Some viruses are spread by insects and animals. These insects and animals are called carriers because they carry viruses inside their body but are not harmed by the virus. Once the humans become infected, when they're bitten by these insects and animals carrying the virus, that is when the problems start. Most of the viruses in this group are found in warm climates where these insects and animals are found all year round. Diseases caused by viruses spread by bites include West Nile disease and the yellow fever. Now I want to get a little bit more into the nitty-gritty details of how a virus infects a human cell. If there's any confusion or questions on this part of the webinar, feel free to write in the chat and I'll try to answer them as best as possible at the end of the webinar. So now getting into how a virus infects a human cell, and you can use this graph to follow along with what I'm saying. So once a virus enters the body, it needs to get inside of a cell before it can create new copies of itself and spread. And that's the major responsibility of the virus, is to get into a cell so it can start using our cell's machinery to start replicating and spread. The types of proteins that are found on the capsule, again, the capsule is this protein that covers the genome of a virus to protect it and help it enter different cells. The different proteins that make up this capsule determine what types of cell the virus can actually enter. So for example, some viruses can only enter cells in the respiratory tract, while other cells can only enter cells in the gastrointestinal tract. So the first step is attachment. Once a virus gets into the body, again through air droplets, bites, directly into the bloodstream, it wants to find its target cell. It attaches itself onto the surface of the cell using specialized proteins found on the capsule or envelope of a virus. The viral proteins stick to another type of protein on the outside surface of a human cell called a receptor. The types of cells that make up a receptor on the human cells determine if the virus can enter. Now, the second step is the actual entry. After the virus sticks to the receptor on the surface of the human cell, it is brought inside the body of the cell and is released from the receptor. The third step is now replication. Once inside the cell, the virus uses the machinery of the cell, so proteins normally found inside the cell, to create new viral genetic material and specialized viral proteins. a virus must be inside a cell to make new genetic material or proteins. The fourth step is assembly. So when new viral particles are then made out of the genetic material and proteins during the replication step, a cell infected by a single virus can produce thousands of new viral particles. And now five in the final step is called release. And once the new viral particles are assembled, they need to leave the cell so that they can infect other cells, right? So they need to spread. Some viruses leave the cell by causing the cell to explode. This essentially kills the cell while releasing all the virus particles at the same time. Some viruses can even remain in a cell for months or even years before they start producing new viruses and leave the cell. It's important to note that a virus actually doesn't want to kill off a human because the human is the way that the viruses are reproducing and spreading and helping keep the virus alive. Now I want to get into an overview of both HIV and COVID. First, I'm going to talk about HIV and then I'll go into COVID. And then after that, I'll be discussing more of the similarities and the differences between the two viruses. So starting off with HIV, otherwise known as human immunodeficiency virus, is a virus that targets cells in the immune system, specifically cells called CD4 plus cells. So what happens is, over time, the immune system begins to fail, which is called immunodeficiency. And this increases our risk of infection and tumors that a normally healthy immune system would usually be able to fend off. If left untreated, HIV infection can lead to acquired immunodeficiency syndrome, also known as AIDS. All right, so getting more into the specifics, HIV targets these CD4 cells, meaning these cells that contain a molecule on their cell surface called CD4. Again, molecules that are on the surface of our human cells help determine what cells that a virus can enter. And for HIV, they're targeting these cells that have the CD4 molecule on their surface. Often, cells that have these CD4 molecules include macrophages, T helper cells, and dendritic cells. So what you need to know is all these cells are really involved in the immune response, and they all contain the CD4 molecule, and thus they are targeted by HIV. What the CD4 molecule does is help these immune cells attach and communicate with other immune cells, which is particularly important when the cells are trying to launch an attack against a foreign pathogen. And moving forward, HIV is an envelope virus with a conical capsid. So again, this is just the shape of the capsid. And HIV, and what I mean by an envelope virus is that besides just being fit into a capsid, so again, the capsid is the protein that is helping protect the genome, a virus can also have an envelope. So viruses are divided into two groups: envelope viruses, which are surrounded by, what an envelope is this outer fatty membrane, and then there's also non-envelope viruses that lack this membrane. But both types of viruses have a capsid. They're helping contain the genome and protect it. Where present, the envelope helps contain viral proteins, which mediates binding to the host cells. And again, HIV is just this enveloped virus with a conical capsid. HIV is a single-stranded, positive-sense, enveloped RNA retrovirus. And what this means is that it injects a single strand of RNA into the T helper cell. And these T helper cells are these immune cells that are helping us fight against different pathogens. What I mean by retro is referring to the virus's need for an enzyme that helps create a proviral DNA. And what this proviral DNA means is that it's ready to be integrated into the host DNA. So it enters the T helper cell's nucleus with the assistance of other enzymes that our body provides, and it's ready to be transcribed into new viruses. When the immune cells become activated, they start transcribing and translating proteins needed for the immune response. So this is what happens with every normal functioning immune system. However, ironically, this means that whenever the immune cell is exposed to something that causes it to start up an immune response, like any infection, like the common cold, the immune cell ends up inadvertently transcribing and translating new HIV viruses, which bud off from the cell membrane to infect more cells. So when a cell is infected with HIV, And when it's being activated to create an immune response, it's actually creating the immune response and also helping spread the HIV virus, which makes HIV very tricky. Within 2 to 4 weeks after infection with HIV, about 2/3 of people will have flu-like illness. And currently, there's no cure or vaccine for HIV. Going into COVID-19 overview. So COVID-19 is part of a family called Coronaviridae, which is a single-stranded positive sense RNA virus. And again, this is similar to HIV in the sense that they're both RNA viruses. Coronaviruses usually cause mild to moderate upper respiratory tract illnesses like the common cold. However, there are 3 new coronaviruses that have emerged from animal reservoirs over the past 2 decades to cause serious and widespread illness and death. 4 of the 7 known coronaviruses that sicken people, again, only cause moderate disease. However, the 3 more serious and even fatal diseases include SARS coronavirus, which emerged in November 2002, and that caused severe acute respiratory syndrome. That virus disappeared around 2004. And then you also have the Middle East respiratory system, so MERS, and that was caused by MERS coronavirus. That was transmitted from an animal reservoir in camels. MERS was identified in September 2012, and that continues to actually still have sporadic and localized outbreaks. And now the third novel coronavirus to emerge in the century is called SARS-CoV-2, and that's a coronavirus that has caused COVID-19, which is known to us, and that emerged from China in December 2019 and was declared a global pandemic by the World Health Organization on March 11th, 2020. And just like HIV, currently there's no cure or vaccine for COVID-19. So now I want to discuss the similarities and differences between HIV and COVID-19. So although they're both encapsulated positive sense RNA viruses, exactly what that means for us isn't really important. It's what they do to our bodies and what the outcome is for us. And they both have no vaccine and cure. So what, besides those 2 major things, is what makes these viruses different and what makes them similar. I will be comparing and contrasting these 2 viruses by 3 main groups. The first being transmission and prevention. The second being the clinical stages of the virus, so the symptoms and duration. And then finally going into the treatment of the viruses. So starting off with transmission and prevention. First, I'm going to talk about transmission and prevention of HIV. So again, when we're thinking back to earlier slides, HIV is spread from direct contact through person to person. There's only certain body fluids, such as blood, semen, rectal fluids, vaginal fluids, and breast milk, that can cause a person who has HIV to transmit HIV. These fluids must come in contact with a mucous membrane or a damaged tissue or be directly injected into the bloodstream, so from needles or syringes, for transmission to occur. These mucous membranes that I'm talking about are often found inside the rectum, vagina, penis, and mouth. Male-to-male transmission is the most common mode of transmission in the US, and male-to-female is the most common mode in resource-limited settings. Although less common, there is female-to-male transmission occurring as well, since HIV is present in vaginal and cervical fluids of infected women. In fact, over 75% of all the cases of HIV are contracted from sexual intercourse. Having vaginal or anal sex with someone who has HIV without using a condom or taking medicines to prevent or treat HIV can further increase transmission rate. And anal sex is riskier than vaginal sex. The next most common means of transmission includes things such as intravenous drug abuse. So when you're sticking the needle into your bloodstream, that can cause direct transmission. Mother-to-child transmission, which can be via the placenta during delivery or via breast milk. Other much less common modes of transmission include accidental needle sticks and the use of blood products like blood transfusions. Now going into the transmission and prevention of COVID-19. The virus that causes COVID-19 is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. Spread is more likely to happen when people are in close contact with one another, and that's why you're seeing all those signs around that are saying stand at least 6 feet apart. So when you're in the grocery store or walking outside, you want to stay at least 6 feet apart from other people to reduce your risk of being infected if anyone around you is infected with COVID-19. One important factor in transmission is that seemingly benign activities like speaking and breathing produce respiratory bits of varying size that can disperse along air currents and potentially infect people nearby. Some researchers say that new coronaviruses can also be transmitted through aerosols, which are minuscule droplets that float in the air longer than large droplets, and these aerosols can be directly inhaled. Another way to catch the new coronavirus is when you touch surfaces that someone who has the virus has coughed or sneezed on. So again, when you're out in public and you've been touching things that other people have been touching, please wash your hands and refrain from touching your face, like rubbing your eyes or touching your mouth or your nose, because you never know what you're putting inside your body. And when you are outside when you're out in the public and touching a lot of things, remember to wash your hands as much as possible and to use Purell and to cover your mouth and nose with masks to prevent yourself from being infected and from getting sick. Because you may be touching a countertop or a doorknob that's been contaminated, and when you go to touch your nose, mouth, or eyes, you're essentially infecting yourself. The virus can live on surfaces like plastic and stainless steel for up to 2 to 3 days. To stop this, clean and disinfect all counters and knobs and other surfaces you and your family touch several times a day in and around your house. Studies are also suggesting that virus particles can be found in infected people's stool. So what experts aren't sure is whether the infection can spread through contact with an infected person's stool, or if that person uses the bathroom and doesn't wash their hands, they could be infecting people by touching things around them. And again, when you touch something that someone has transmitted the virus on, and then you touch your face, again, you're infecting yourself. So refrain from touching things as much as possible when out in public. And when you are, remember to wash your hands, use Purell, cover your face with a mask. Again, that needs to cover your nose and mouth. Now going into the clinical stages of the diseases caused by the virus. Starting off with HIV, the World Health Organization defines HIV in 4 clinical stages. The first stage is called infection, so that's when HIV is quickly replicating in the body after infection. Some people develop short-lived flu-like symptoms, for example, headaches, fever, sore throat, and a rash within days to weeks after infection. During this time, the immune system reacts to the virus by developing antibodies. This is known as seroconversion. The second stage is called asymptomatic. As the name suggests, this stage of HIV infection does not cause any outward signs or symptoms. A person may look and feel well, but HIV is continuing to weaken their immune system, again, by attacking those cells with the CD4 markers. This stage can last several years, in fact, and without an HIV test, many people do not know that they're infected. Stage 3 is symptomatic. So over time, the immune system is becoming damaged and weakened by HIV, and symptoms are beginning to develop. Initially, they can be mild, but the symptoms do worsen. Symptoms can include fatigue, weight loss, mouth ulcers, thrush, and severe diarrhea. The symptoms are most often caused by the emergence of opportunistic infections. And these are referred to as opportunistic infections because they take advantage of a person's weakened immune system. And again, thinking back to what HIV does is it attacks your immune system cells. And when your immune system is under attack, it's having difficulty even fighting off smaller illnesses like the common cold. Stage 4 is called AIDS, or progression of HIV to AIDS. There's no single test to determine for AIDS. A doctor will look at a variety of symptoms, including the CD4 count. So again, the cells that have these CD4 markers on it. the viral load to the amount of virus that's within the person, and the presence of any opportunistic infections. And all three of these are used in order to make an AIDS diagnosis. The CDC's definition of AIDS includes less than 200 CD4 T cells per cubic millimeters of blood, compared to about 1,000 CD4 plus cells for healthy people. Now going into the clinical stages of COVID-19, what I have laid out is three major stages. And the first one is starting with the asymptomatic state. So this is when the person has inhaled the virus and the virus now has bound to their epithelial cells in the nasal cavity and starts replicating. Symptoms develop 2 days to 2 weeks following exposure to the virus. However, the average incubation period is about 5 days. It's not clear yet how many people are asymptomatic carriers of the disease, nor is it clear how much they are contributing to the spread of the pandemic. However, through preliminary research, it suggests that they do play a significant role. Some estimates suggest that about 80% of coronavirus cases may be mild or asymptomatic. Stage 2 is upper airway and conducting airway response. So this is the next few days, about 5 to 8 days after the initial infection, and you're starting the onset of symptoms. The virus propagates and migrates down the respiratory tract along the conducting airways, and a more robust and innate immune response is triggered. Among patients who develop severe disease, the median time to having difficulty breathing from the onset of illness or symptoms ranges, again, from 5 to 8 days. Now, the third stage is progression to acute respiratory disease. So that's about 8 to 12 days from onset. Unfortunately, about 20% of the infected patients will progress to stage 3 and will develop pulmonary infiltrates, and some of these will develop very severe disease. Initial estimates of fatality rate are around 2%, but this varies markedly with age. The fatality and morbidity rates may be revised once the prevalence of mild and asymptomatic cases is better defined. The median time to acute respiratory distress syndrome, again, from the onset of illness or symptoms ranges from 8 to 12 days. And then the median time to ICU admission from the onset of illness or symptoms has ranged from 10 to 12 days. The median length of hospitalization among survivors was about 10 to 13 days. Finally, getting into treatment. Starting off with HIV treatment. Again, there's currently no cure for HIV. However, HIV treatment involves taking medicines that slow the progression of the virus in your body. HIV is a type of virus called a retrovirus, and that combination of drugs used to treat it is called antiretroviral therapy. ART prevents viral replication by attacking various ways the virus enters the cell and replicates. And each class of drug blocks, again, the different ways in which the virus attacks us. It involves a combination of drugs from different classes, again, to account for individual drug resistance, avoiding creating new drug-resistant strains of HIV, and maximizing suppression of the virus in the blood. Everyone with HIV infection, regardless of the CD4 T cell count or symptoms, should be offered antiviral medication. Remaining on effective ART with an undetectable HIV viral load in the blood is the best way for you to stay healthy. Now getting into COVID-19 treatment. There's no specific treatment that exists for COVID-19 right now. Currently, what we know about COVID-19 is really preventative care. Most people who become ill with COVID-19 will be able to recover at home. But it's important to call your doctor to ask whether you should stay at home or get in-person medical care. To stop the spread of coronavirus, people who are sick need to self-quarantine or stay away from those who are well. Because you may not show symptoms right away, you should also self-quarantine if you know that you've come in contact with someone who has COVID-19. The amount of time that's suggested for self-quarantining is about 14 days from the last day of exposure to COVID-19. You treat your symptoms, again, by getting lots of rest, drinking lots of fluids, and taking over-the-counter medications like Tylenol to help lower your fever. And the most important thing, again, to stop the transmission is self-quarantining. Currently, there are no vaccinations, but that is in trial. And now I want to finish the webinar off with a brief clip of Dr. Kathy Kritikos, she's the director of the infectious disease at Howard Brown Health. And she's discussing a lot of the similarities and disparities of the COVID-19 pandemic to the HIV epidemic.
Obviously, COVID-19 has presented a greater circumstance than I think anyone from my generation has ever known in their lives, but maybe someone such as yourself, as you mentioned, your 25th anniversary at your facility today. Congratulations again.
Thank you.
25 years in HIV at a time when this was probably the scariest pandemic in the world, correct? And we're talking a lot about the parallels that we see with COVID-19. Can you fill us in a little bit about what those parallels look like and lessons learned from the early HIV era that we can apply now?
Well, as I've told many of my colleagues, I feel a tremendous sense of deja vu as somebody who worked, actually, even before I joined Howard Brown, I had been working in the HIV field. So again, I've been around since the beginning, and, there was this population of people who were getting sick and dying, and yet we had no treatments for them, and we really didn't even understand the disease. So here we are in 2020 with this disease that kills people, that we don't have any treatments for, that we don't really understand the full manifestation, presentation, biology of the virus. We're really dealing in the same situation as we were at the beginning of the HIV epidemic. We have to try things without really having any treatment. So try everything, have nothing, try everything kind of approach, but with a very reasoned, understanding of why you're doing it. So try to do it in a thoughtful and academic way, but you can't wait 3 years for randomized controlled trials to move ahead and try to help patients. So that's kind of one aspect. The other aspect that, some people don't recognize, but the fear of dealing with a contagion where you really just don't know how is it transmitted. We're learning as we go. What are the things that help prevent transmission? What are the things that aren't successful in preventing transmission? That was very much true at the beginning of the HIV epidemic. And the stigma associated with the disease, which unfortunately is still extremely profound with HIV, much more so than it should be all these years later. But there's still actually a stigma with COVID. There's a sense of this individual somehow did something wrong to get COVID, that they weren't careful enough, or they didn't care enough about personal protection, or something like that. And the final thing I would like to say is that as a healthcare provider, even when we don't have treatments, we can alleviate suffering. And that is something that, I think healthcare providers have really rushed to do in this epidemic, and did in the beginning of the HIV epidemic, is that even when you don't have treatments that are working, you can help alleviate suffering.
I'm so glad you mentioned that too, because it's something that I keep returning to.
Yeah, so that's what I have for today. I hope you found new information and anything interesting combining both comparing and contrasting COVID-19 and HIV. Again, if you have any questions, just let me know, and type that in the chat, and I'll try to answer it as best as possible.